This is Dr. Howard Strassler with a Hints from Howard on oral care products. Do you know what to recommend to your patients? Let's face it, dental's health foe is biofilm, plaque. That sticky substance that holds on to the enamel and root surfaces that cause both caries and periodontal disease. Are there oral care products out there that will help our patients combat the diseases that plaque causes? But before we blame plaque for everything, really it's also our patients' diets. That how they're feeding that bacteria also contributes to what's happening in their oral environment, the diseases that they have, both to the soft and hard tissue, as well as the saliva, the changes in salivary flow and its impact upon patients' oral health. So how do we battle plaque? We use oral care products from toothpaste to toothbrushes, mouth rinses, interproximal cleaners. I mean, there are lots of products out there. In fact, it really is important that you know what's out there, what the manufacturers are providing to our patients, how our patients are being bombarded by the products that are out there. In fact, take a field trip. The next time you're in the pharmacy, in the grocery store, look at the aisle of all those different products that the patient has to make choices from. Can we help them make better choices? So what oral care products are your patients using? And I said, do a field trip. Look at the toothpastes, the toothbrushes, both mechanical brushes and those that are used by hand. Look at the different mouth rinses that patients have choices from. Don't forget there are denture cleaners out there, and our patients who have complete and removable partial dentures, they would benefit from recommendations. And there are denture-specific brushes for cleaning dentures, for cleaning the acrylic bases and acrylic teeth. For some patients, the dentures just don't fit well no matter what you do. Certainly implants can make a difference for complete dentures. But look at the denture adhesives they're using. And then the use of floss, which has become controversial with articles that have been in the media lately, and what interproximal cleaners can disrupt that plaque. And then, of course, the goal to have that Hollywood smile, whitening specific products that are out there that go across many of the different categories. So let's start with the end, the patient who's getting dentures. Are you making recommendations for denture cleaners, for pastes, for tablets that effervesce? Are patients needing to use denture adhesives for stability? Do dentures need relining? And keep in mind, patients should not use toothpaste on acrylic denture teeth or acrylic denture bases. That toothpastes are way too abrasive and will damage dentures and partial dentures. Patients want to keep teeth for a lifetime. They're battling dental pathology. In fact, if you take a look at us as baby boomers, us as 100-year-olds and plus, that we're the largest growing segment. Our patients are presenting to the office with gingivitis, periodontitis, with sensitivity on root surfaces, with caries, as well as acid erosion. And through our diagnosis, we can make recommendations about the oral care products that they should be using. So let's start with mouth rinses. Mouth rinses can treat gingivitis. Listerine in its essential orders has an ADA seal and an FDA approval to be able to say that they fight gingivitis. There are fluoride-containing mouthwashes for patients with high caries rate. Patients who are using mouthwashes and, in fact, breath drops and breath mints to combat bad breath for a variety of different reasons, from smoking to patients who like food that have certain odors. Oral lubrication using mouth rinses and toothpastes to combat dry mouth. And it doesn't make the mouth necessarily wetter, but it changes mouth feel. Know those products, Biotene being the most popular out there. And then mouth rinses that have combinations of different effects. You should know your oral care products and make recommendations based upon that. And then toothbrushes, from manual toothbrushes to mechanical brushes. There's no doubt the research proves that mechanical brushes are more effective than manual brushes. How often are your patients changing their manual brushes? How do they know when it's time to change them? Our patients are using these manual brushes with different pressures, causing the bristles to be worn prematurely with mechanical brushes. And then what the costs are. Not the upfront cost of the mechanical brush and its entire system, but also the replacement brushes, which can run as high as $20 each. There's something that you can talk to your patients about, that the dental hygienist plays a key role in oral care products and making recommendations and understanding what's out there. And then there's interproximal cleaning, and on the upper right hand corner, if you were to do an internet search with Bing or Google looking for pictures of flossing, the pictures always show using floss incorrectly. We're wrapping it around the teeth. In fact, it almost requires a PhD and incredible willpower to remember how to clean teeth without damaging the interproximal papilla. Flosses still have a use for removing food, for still disturbing the plaque, for having some role in controlling oral diseases. But interproximal cleaners also have a role, depending upon the size of the embrasure. Toothpicks, that old standby stimulants, make a difference. Or opal picks from Ultradent in its thin plastic shape is fantastic as a cleaner. And keep in mind, when we're talking about cleaning, whether it be brushes or interproximal cleaning, look at the patient's oral conditions and what are exactly the restorations or what's in their mouth. Patients with orthodontic treatment need a much higher level of technique for removing the plaque, for removing the biofilm. May need supplemental fluorides and remineralizing agents. But let's focus on toothpaste. There are so many choices, so confusing, and my focus is going to be over-the-counter toothpaste, not prescription strength fluoride toothpaste like Prevident 5000 Plus, but over-the-counter products that don't need a prescription. It's so many choices, so confusing. In fact, when you walk up and down the aisle with the shelf spaces, it seems like there's a new toothpaste brand every week. And in fact, the patient may have old standby products that they like that are being replaced and they don't know what choices to make. And so I want to talk to you about all the different categories of toothpaste that are out there, because there isn't a one-size-fits-all when you're choosing and looking at toothpastes. So let's take a look at the categories that are out there, what will help shape our patients' recommendations to our patients. We have toothpaste for caries prevention, anti-tartar toothpaste for calculus reduction, gingivitis reduction toothpastes, plaque formation reduction toothpastes. There are natural toothpastes with no artificial ingredients. For our xerostomach patients, we may make recommendations that are slightly different. There are remineralizing toothpastes for battling acid erosion, certainly a very popular product and topic for the ads on the TVs and in the media. Sensitivity reducing toothpaste, a very strong category as our patients age, patients trying to battle dentin hypersensitivity. But let's face it, when patients look at toothpastes, they want toothpaste that also have the cosmetic effect of whitening. And then the multi-care toothpaste, everything included. How do we help our patients make that choice? In fact, keep in mind that patients see us endorsing oral care products through the fact that for those offices that give a goodie bag with toothpaste, floss, and toothbrushes, that we in fact are making an endorsement of that product. That's what you need to use, when in fact we need to look at what the patient's oral care needs are and make a recommendation based upon their specific needs. Well, no matter what toothpaste you're recommending, the ingredients are many. that the common denominator to be called a toothpaste, you must have an abrasive. The abrasives range from carbonates to phosphates, silicas, alumina, lots of different abrasive products within toothpastes to help remove the plaque, in some cases help remove the stain. And the role of the toothpaste abrasive, whether it be a gel or a dental paste, is the trend for whitening and stain removing. A toothpaste is more effective with an abrasive at removing bacterial plaque. And the hardness of the abrasive has a direct effect on enamel and dentin surfaces. It can be kind and gentle to the enamel and dentin, or it can be severe, causing dentin and enamel abrasion and erosion. There are abrasives that are used as natural buffers to the acidity in the mouth, sodium bicarbonate being one, baking soda. And how do you compare toothpaste relative abrasivity? And in fact, we use the term RDA number, which stands for actually radioactive dentin abrasivity, for the way they test abrasives in toothpaste. But we know that the RDA number, the less abrasive, the lower the number. And we can't make the assumption that whitening toothpastes have high RDA numbers. In fact, if we look at the Mohs hardness of different things that are in dental toothpastes, dentin with a Mohs hardness of 2 to 2.5, that baking soda is the abrasive, and dicalcium phosphate dihydrate that's very similar to the hardness of dentin. Enamel is pretty hard, but we can also get up there with higher numbers of hardness to where alumina is a little bit more than 9. Alumina is a common compound in our composite polishing pastes, our composite polishing abrasives. And so there's a variation in hardness or the softness of the abrasives that are used. You should know those abrasives when making recommendations. In fact, to find out RDA numbers, rather than looking on the internet or just getting numbers from tables, you can call the manufacturer. Manufacturers are doing RDA tests on all their toothpastes. And to give you an idea as to what RDA numbers mean, 4 would be the ADA reference for a toothbrush with water. 7 would be plain baking soda. The FDA's recommended limit is 200, while the ADA recommended limit is 250. Different toothpastes have different abrasivity, and as I said, just because a toothpaste is whitening doesn't mean it's too abrasive. Some of the lower abrasive numbers are actually some of the whitening toothpastes that are already on the market. Smoker's toothpaste for removing stain can be the most abrasive and have the high potential to harm both enamel and dentin. Smoking toothpastes have a very specific role, and that role is removing stain from coffee, tea, wine, and they'll tell you that they're for removing stain, removing tough stains. But really the primary ingredient that we want in all toothpastes is fluoride for its anti-caries effect, for fighting cavities. And the selection of fluorides in the toothpaste range from stannous fluoride, sodium monophosphate fluoride, sodium fluoride, that these fluorides are protective of the enamel and dentin and increase active acid resistance. In fact, the fluoride has bactericidal effect and anti-plaque effects. Fluorides can also have other effects, including reducing tooth hypersensitivity. Fluoride toothpastes are typically for our younger patients, our patients who don't have any other oral conditions, but we want to protect the teeth during the time of greatest caries, caries sensitivity, caries proclivity. We see toothpastes that are on the market for tartar protection, for calculus reduction, anti-tartar toothpaste. These are toothpastes that have been proven to reduce calculus buildup. They typically contain some pyrophosphates, maybe some enzymes like papain and citroxane. Remember that this is not a therapeutic effect. Tartar protection, anti-tartar calculus reducing toothpaste, that anti-tartar is considered a cosmetic effect and not a therapeutic effect fluoride is considered a therapeutic effect to prevent caries. Then we have toothpaste with desensitizing agents in them, using the term relief, sensitive toothpastes. The most common active ingredient is a potassium nitrate, 5% potassium nitrate. It's based upon an FDA monograph, so if you put 5% potassium nitrate in your toothpaste, you can make the claim that you're helping desensitize teeth, helping fight dentin hypersensitivity. Typically, this reduction of dentin hypersensitivity with potassium nitrate is a depolarizing effect on the odontoblastic processes in the dental tubules, and with the repolarization of nerve endings, you see a reduced pain response. There are also a brand of toothpaste that has arginine bicarbonate calcium carbonate. Some have stannous fluorides. Their reduction is typically a clogging of the dental tubules, very similar to what we do with our in-office professional desensitizing. Some toothpaste make claim of anti-plaque agents that reduce plaque growth, have the potential to reduce gingivitis, the potential to reduce caries. Some of the anti-plaque agents in toothpaste include triclosan, papain sanguinaria extract. Now keep in mind, triclosan is accepted by the FDA in dentifrices and toothpaste as being anti-plaque, anti-gingivitis, as a therapeutic additive to toothpaste, although if you read my commentary, you'd realize that triclosan has also become under scrutiny by the FDA in terms of its being placed in antibacterial soaps and detergents and toys, and that you'll see that there'll be a ban on the use of triclosan in soaps, in detergents, in children's toys over the next 3-4 years because of concerns about the bad effects of triclosan. Yet it's still present in toothpaste, and I'd recommend you look at the link in the commentary, put in triclosan, and actually do a search in Google or Bing to become better educated. Colgate Total is the only toothpaste that has triclosan, and in fact you'll notice that in Colgate Total that they also many times have whitening and other effects. We're seeing more remineralizing agents, mostly through the use of fluorides, although there are some products that have calcium phosphates. GC allows us to buy from them and give to our patients something called MI paste, which has a calcium phosphate in it. And these are to enhance remineralization, and you'll certainly have an effect upon dental caries reduction, but really the focus on reducing acid erosion. Acid erosion is everywhere in the foods we eat, the beverages we drink, even those good beverages like orange juice can cause acid erosion. Our power drinks that we drink, our Red Bull and other drinks that are out there, are very acidic, even more acidic than the soft drinks that we're having. And so we're looking to reduce acid erosion through using these remineralizing agent toothpaste. But keep in mind, when you look at toothpaste, you'll always notice that it's not just one additive many times. It's many different ingredients that have effects that are very positive. And some of these remineralizing agents also have a positive effect with some dentin desensitization. And toothpaste contain other ingredients, and the one I want to focus on first is detergents. The fact that when we brush with toothpaste, it foams in our mouth. It has sodium lauryl sulfate in it, but now sodium lauryl sulfate, while giving us that foaming action, is very positive, that it can be associated with oral mucosa desquamification, sloughing of soft tissue. In fact, patients with apthous ulcers might do better with an SLS-free toothpaste. For example, the natural toothpaste Toms of Maine that are SLS-free. And natural toothpastes many times will contain fluorides and other ingredients that will be beneficial. They'll be as effective as our typical dentifrices, typical toothpastes. And then there are other additives that give the toothpaste the look and feel and the way they work, from humectants that have an effect upon toothpaste texture and moisture maintenance, glycerin, water, sorbitol, thickeners to provide body to toothpaste. In fact, the thickeners are many times the same silicates that are used in thickening composite resins. You see carrageenan and xanthan gum. All of these things give toothpaste the ability to have the right mouthfeel, the right taste, the things that are in there to help toothpaste work better. Other ingredients in toothpaste include preservatives to prevent microbial growth, methylparaben, sodium benzoate, flavorings, minty to fruity. Everyone has their flavor that they like the best, that they choose from. Some toothpastes are putting in herbal agents from aloe vera, echinacea, golden seal, others, but there's no proof of any efficacy by adding these natural herbal agents. You're seeing coloring agents that are being placed in to make toothpaste look good. And then use of sweeteners. Most are artificial and not sugar, so we can have the taste that we want from a toothpaste. And a large category of toothpaste are these multi-care toothpastes where one size fits all, that provide us with anti-caries, desensitizing, reducing acid erosion, treating gingivitis, tartar control, freshening breath, whitening, and more. In fact, when you read the sides of these boxes of toothpastes, you'll see it'll say cavities, gingivitis, plaque, sensitivity, tartar, whitening, freshens breath. So here's a one-size-fits-all, and these are very popular categories of toothpaste for patients to use. In fact, you might say, can children use these toothpastes? And yes, they can use these toothpastes, but it may be a little bit of overkill for what their needs are. And keep in mind, when a child's using toothpaste, it should be the size of a pea on that toothbrush. Most children don't spit out when they're brushing their teeth, but they swallow, and they could be ingesting fluoride and causing fluorosis if they're swallowing too much of toothpaste that have fluoride. And then we come down to, do toothpaste do what they claim? And really it's a difference between making a claim that's a therapeutic effect. Reduction of caries is a therapeutic effect. Desensitizing is a therapeutic effect. Anti-gingivitis is a therapeutic effect. And these claims must be proven before you can put it in. For caries reduction and desensitizing, and the FDA has a monograph that says if you put certain active ingredients in, you can make those claims. Most are, though, cosmetic effects. There are no controls. You can say that it freshens your breath. That's a cosmetic effect. You can say that it's whitening. That's a cosmetic effect. Any toothpaste can make a claim of whitening, and typically it's stain removal, although we're starting to see toothpastes on the market that have hydrogen peroxide, that have a bleaching effect similar to that of the bleaching agents we're giving to our patients from our patients using over-the-counter bleaching agents with carbamide and hydrogen peroxide. So add what oral care products your patients use. Add it to your dental medical history form. Patients say, I brush and floss. Well, can I know what you're using? And be product specific when you have them make write down what they're using. Know what your patients are using, because really the recommendation for oral care products should be based upon needs and what the patient's oral conditions are. From caries to periodontal disease, dry mouth, patients that may have appliances in their mouth that may hinder their maintenance of their oral care or may heighten the growth of bacterial plaque, patients with orthodontic treatment, patients with older restorations, teeth that are misaligned. All of these things have an impact upon the recommendations you're going to make. And then make recommendations that are patient-specific based upon the patient needs, and the dentist and dental hygienist need to work together to both educate your patients and your staff. Are you giving samples of products? And I mentioned earlier, when you give samples to your patients, you're making an endorsement. In fact, you may decide that there are only specific samples you want to have that you put in a goodie bag to your patient, that you may put out in a basket that the patient can grab when they leave. So know your oral care products. Go to the manufacturers to provide them for those products that you want to recommend for your patients. Remember that you're advertising for the manufacturer when you give these samples out. Well, this was Dr. Howard Strassler with a Hints from Howard on oral care products. Do you know what to recommend to your patients, what your patient needs are?